Thank you. So again, my name is Sharmila, and I'm Executive Director with the Staten Island Not-for-Profit Association, and we are really thrilled that you are here this morning. Please take a moment to drop your name, organization, and affiliation pronouns in the chat box, along with one word to share, I am looking forward to. I'd also like to let people know again that we are attempting to stream to Facebook. So we are live there. We are also recording today, so you're welcome to stop your video if you'd like. At the bottom of your screen, I'm assuming everyone is very familiar with Zoom by now, but you can pick one of the tabs at the bottom to show the captions or live stream a transcript. I'm going to ask, we don't have that much time today during the main meeting anyway for conversation, but when we do break out into rooms or we do have a question and answer period, please say your name when you begin speaking. And if you're sharing any visuals, you can describe what's on the screen. To ask questions or comment, I ask you to please use the raise your hand feature, also located at the bottom of your screen. Drop it in the chat box. We have some of our team members monitoring the chat box. I ask that you please don't send me anything directly, because while I'm sharing my screen, it's hard for me to access the chat box. And then, of course, if we are speaking, you can come off mute to speak. Any questions? And again, you can just take yourself off mute and type in if you have any questions, because I can't see everyone. All righty, great. I'm now going to invite our intern turned staff team member, Linda Levin, to start us off with our land acknowledgement this morning.
Good morning, my name is Linda. I have black hair. I am a white woman, and I'm currently in my office where there's a white screen, a white wall. Staten Island is located on the island known as Aquehonga-Manakenong, the homeland of the Munsee Lenape people. SINFPA pays respect to the original stewards of this land, Lenape and other indigenous peoples, and strives to support the Native American, First Nations, and indigenous communities that continue to thrive in New York City. This acknowledgement demonstrates a commitment to beginning the process of dismantling the legacies of settler colonialism and reminds us of our important connection to this land where we live, learn, and work. We recognize, honor, and respect these nations as traditional stewards of the lands and water on which we are now present. On the screen, you will see a picture of the Northeast, which has Connecticut, New York, Pennsylvania, and Maryland, and it shows the Lenape land in light green, olive green, and a dark green.
Great. Thank you very much, Linda. We are going to drop the agenda in the chat box as well as the slide deck in a PDF, so you're able to open it on your own. We're using this as sort of our program today. If we were meeting live in person at a beautiful venue in Staten Island, which we will soon do again, you would have a beautiful booklet in front of you. But in lieu of that, we are sharing this and hope that you will check out the links and all of that in the chat box or later on in the deck. So briefly want to review our agenda. We'll start with our board chair's report and call to order. We'll have a moment of reflection. We'll have a remembrance of someone very important to our sector over many, many years. Our staff team will do a brief year in review, and then we'll have keynote remarks from Dr. Ginny Mantello, Health and Wellness Director for the Borough. And we'll go into our governance committee report where we re-elect board members, we'll do the election of officers, and we'll welcome our newest board members, which is very exciting. And then our committee reports will share some background of how we got through this year and the exciting programs that we have coming up and some other work that we're doing. And that'll lead into the upcoming events, as well as we're hopeful to have time towards the end for breakouts and a little bit of peer exchange. So we hope that you'll stick with us. With that, I'm very pleased to pass the baton to Adriana Botti, our board chair for the past year and executive director of the Staten Island Partnership for Community Wellness. So sensitive today.
It's okay. So good morning, everybody, and welcome. I'd like to officially open the annual meeting of the members and partners of the Staten Island Not-for-Profit Association meeting. It's thrilling to see so many of you in Zoom boxes. This is our second year of actually hosting this meeting virtually. And while it's worked and in many ways it's increased accessibility, there's nothing like seeing people face to face. And I know that many of us are craving that. I feel like one of the greatest perks of being part of the Staten Island Not-for-Profit Association are those opportunities to be with colleagues and peers for both the learning, to collaborate on initiatives, but also those social aspects, right? The laughing, the schmoozing, those are how relationships are built. And I know it's helped me to improve the way that I've been able to do my work at my organization. And it's also just made me feel just personally, like I've got a network of friends across the borough. So I'm looking forward to being back in real life, IRL. And we're almost there. And I feel like we're almost there because it's the actions of the members of the association, right? It's the nonprofits who have been serving people throughout the island in terms of social services or cultural activities, keeping people inspired and connected. It's the healthcare providers who are in the front lines. It's our government partners that we're going to hear a little bit from Dr. Ginny Mantello about this beautiful partnership between government, nonprofit, and healthcare. But it's really also the infrastructure of SINFPA. I know that we've all been on the receiving end of Sharmila's emails where she outlines funding opportunities, trainings that are critical to the delivery of services, and even supplies and resources. So I just want to acknowledge the importance of having SINFPA, especially in this time of the pandemic, because it's helped to keep many of our lights on, our doors open, and our staff safe. So before I transition this off to Reverend Karen Jackson, I just want to acknowledge the small but mighty staff who inspire and connect us to important resources and are just critical to the operation of our nonprofits. So for that, we are eternally grateful. So now I'm going to hand it off to Reverend Karen Jackson, who is the Director of Recovery and Community Initiatives at Project Hospitality. She's also the Administrative Director of the LTRO and a member of our co-ed. She's going to lead us in a moment of reflection.
Good morning, everyone. I think given that this is the annual meeting of the Staten Island Not-for-Profit Association, I think it is important that we take a moment in this annual meeting to recognize just how difficult this past year has been on our community and the particular challenges that have been faced by Staten Island human service providers. We all have such a unique mission in that we're all trying to work ourselves out of a job. We want all of these collaborative efforts to meet the needs of our neighbors and to be so effective that they don't need us to be here anymore. And yet we know that we always will be needed. And the COVID-19 pandemic has created this whole host of new needs for the people that we serve while exacerbating already existing inequities. Our Staten Island nonprofit organizations really have so amazingly risen to the challenges that this pandemic has posed to all of us. I mean, if you think about it, our food pantries have served more meals this year than in any previous year, even with a significantly reduced volunteer capacity. And we've all had to pivot, learning to use new technology, to be able to continue providing services while not being able to do so in person with our clients in many cases. And I'm sure you've all learned more than you ever wanted to know about K95 masks and how to install plexiglass barriers. And all the while, we're doing this important work to meet the needs of others while experiencing this as people. We are people ourselves with our own problems and our own grief, pandemic related and non-pandemic related. So I'd want to take a moment to say thank you to all of you who are here. Thank you for being on Zoom all day, every day. Thank you for the ways that you have really gone above and beyond, because for nonprofit leaders, we know this isn't just a job for us. This is a calling. And the sacrifices that you have made aren't always seen, but your Staten Island community really is so grateful for everything that you've done. Thank you. So I'd like to invite us now to observe a moment of silence And in the silence, let us honor the people that we have lost this year to COVID-19 and other losses, and to honor the work of the not-for-profit sector on Staten Island for all that we have done to preserve life. Thank you. I would like to invite us to recognize one particular giant loss that we grieve today. The life of Betsy Dubofsky, who was the founding executive director of the Staten Island Foundation, a beloved friend, an incredible advocate for the Staten Island community. And so we honor the work of her life and her contributions to our borough today. And I know Adrian Abadi has prepared a memorial moment for Betsy.
Thank you, Karen. I wouldn't say it's a formal memorial. It's more just kind of an acknowledgement because Betsy passed very suddenly, felt very sudden to all of us when it happened in February. And she left a tremendous void in the not only the nonprofit sector, but across the whole borough. She was a visionary and she invested in innovative ideas and nonprofit services. So she, I think, was a supporter of many of us across the association, but then also invested in the infrastructure of the association. She realized that nonprofits were critical in supporting children and families on Staten Island, not only direct services, but the arts. Like she supported, plays in schools and museum programs and coalitions to address substance use. She realized that in order for families to thrive on Staten Island, that they needed to have communities that were rich with services and opportunities. So I'm still in shock. I know that many of us are. Thank goodness we have Laura Jean at the foundation to continue Betsy's work, but then also to take it in a new direction. We're grateful for that partnership. And I know that there's still memorials being planned for Betsy, and that many of us are thinking about an appropriate way to really honor her work. Is it through a day of service? Is it through planting? So it happened in a time of COVID where I feel like people were not able to come out and grieve in the way that they had wanted to. So I think that more is to come along the lines of how do we honor Betsy. But I think that the way that we can do it is to continue doing the work that we do, because that's what she would have wanted, right? That's what kept her going and inspired her. So I feel like every day that I do my work, I have her little mass card right here. And I'm doing it in her memory because she really was such an ardent advocate for Staten Island. And I know was so incredibly proud and is still looking down and supporting us in this important work.
Thank you, Adrian. And thank you, Karen. I agree that it has been a tough loss in many ways this whole year. We've all been through so much. So I appreciate having this time to be together, and at least virtually. We're now going to go into a quick year in review. A lot of what we've done, as Adrian said, has been shared to you through various social media channels and newsletters, and it's part of this deck. It's there mostly as a record for you to review later on. I'm just going to give a few brief remarks. Some of our board members received a gift from the association last year and the year before. It's a book by Priya Parker called The Art of Gathering. And I've been rereading it because we've been gathering in these new and different ways over the last year. And it has been a discovery each and every time. We learn something new, we have a challenge. And I think that this more than 1 year has taught us a lot about how to be together while distant. And as we reemerge and as we come back together, I want us to remember all the things that tested us and the compassion that we've had, because as we reemerge, it's going to be more difficult for some of us than others. One of Priya Parker's main tenets in her book is, when you gather, make sure you outline your purpose or your mission. Every day I get requests for Zoom meetings, and I have to stop myself or stop the other person and say, can this be a phone call instead? Zoom is really draining. I have to say that I have really been challenged by the ways we've been asked to show up over this last year. And I have a little bit of anxiety about going back to in-person myself. I saw people for the first time socially over Memorial Day weekend, and I had trouble making eye contact because I'm so used to doing it on a screen or turning off my video when I need a moment. So for today, our purpose, our mission in being together is this. It is to reemerge, to reflect, to reconnect, to regenerate, and to heal, and to really look forward with hope, enthusiasm, and excitement what's on the other side of this experience of what we are emerging from. As we've acknowledged many times over, this past year plus has been unprecedented in every single way imaginable. Throughout the pandemic, our nonprofits, our essential workers, all of you have been on the front lines and often working in difficult situations, taking care of our most in need, our communities of children, parents, neighbors, loved ones, even people we don't know, in a variety of ways and in a variety of settings. Through our collective in-person and virtual programs, efforts, creative initiatives, nonprofit professionals and our partners like yourselves have innovated and taken initiative to provide guidance, to care, and to give endlessly and so fully. Yesterday, I was part of a meeting where Reverend Jackson had us do a little bit of reflection and an exercise, and it really stuck with me. She had us spend 3 minutes writing down without stopping just our thoughts on this past year. And I was surprised by what I wrote down, and I wanted to share it. As challenging as this year has been, and how many days or nights I've worked into the early morning hours and thought, I can't do this anymore. When I wrote, I realized that for every negative, if you will, word, there was a positive. This year has been exhausting and draining and filled with sadness and challenges, but it's also been fulfilling and re-energizing in so many ways. We lost so much, but we've also gained a lot: perspective, relationships, community, funding, new opportunities. I'm trying to see that the doors are opening, and you all adapted. You were resilient. It was a struggle for survival, not only individually and in our families as communities, but your organizations, your businesses. And I really feel from the beginning, the stories that we heard were of resilience, of recovery, and of survival through the crisis. That collective care, this interconnected community, is why we're here today and why we're going to still be here. We did a focus group with the Staten Island Chamber of Commerce and Techie Geek last week, and it was really eye-opening to hear from each other about how we will return and the concerns on our minds. And we hope that today and continuing on, we'll get to really tackle those and together continue to come up with solutions. Last year, and I'll close with this, many of you remember me sharing a principle that I brought through my life from my father, who passed away when I was in college. It was good, better, best. Never let it rest till your good is better and your better is best. And the first year of the pandemic taught me I needed to set that aside because best was going to be impossible. And it was Dr. Ginny Mantello and Reverend Karen Jackson and Adrian Abadi and David Sorkin, Shirley and Joe and Tina, part of our initial COAD steering committee and incident command team, that taught me that we cannot let perfect be the enemy of the good. But let me tell you something. I have been driven by good, better, best. Never let it rest till your good is better and your better is best in this community. None of you have spent a day feeling defeated and not coming back tomorrow. Each and every one of you I have seen or heard from just keeps going. And for that, I am really grateful. I am really proud to be a part of this community, and I am hopeful. in continuing to find community with and in each other. And I ask that as we emerge, we continue to show the love and compassion that we have had throughout this past year plus, and to remember as we reemerge and look forward how resilient and nimble we have been, because that is what is going to get us through to the other side. Thank you for being here and for being part of our community and trusting us to be partners in this work together. In some ways, the journey continues and we're just getting started. I am now very excited to announce that, many of you know because he's been here for 6 months, that Frank Lancero joined the Staten Island Not-for-Profit Association and the Staten Island COAD as program manager in October. Talk about no time to really be onboarded and jumping into a crisis mode in every way, shape, or form. He has been an incredible partner to me, to the board, to the association, to our community. I am so thrilled that he joined us and is here today to share a little bit, it's been so much of what the COAD and our medical ecosystem subcommittee has been doing. Before I say that, in the slide deck, which you can open the PDF, there is a year in review of all the events and programs that we've done, and our program team on the board will share a little bit more about that later on. So I didn't want to focus on that. Frank, I'll let you take it over.
Excellent. Thank you so much, Sharmila. Are you going to be sharing the slide deck or? Okay, excellent. Thank you so much. So if we can pull up the slide, one more, there we go. All right, excellent. And thank you so much for that intro, Sharmila. That was just the way you put that was really, really touching. Just the way you covered everything about the last year plus. Without further ado, I'll get going. So here's a quick overview slide. One back, actually. The value of Borough, there we go. The value of Borough Coalition in bridging gaps, linking programs, and serving community. Sharmila and I always talk about the 4 C's: communication, coordination, coordination, cooperation, and collaboration. And so here is a bulleted list of the slides that we'll be covering here. Broadening vaccine education and access across the borough, the Staten Island COAD MES Communications, our community ambassador program that we stood up, hosting and co-hosting community town halls, our needs assessment survey and PPE distribution, the Staten Island Stay Strong, Stay Safe public messaging campaign, and there's our hashtag, don't be shy, check it out. And the Staten Island COVID-19 Vaccine Task Force, which was recently stood up, and the school and community vaccine pop-up clinics. Next slide, please. So talking about broadening vaccine education and access throughout the borough, keeping track of eligible populations and the influx of vaccines as the vaccine was rolled out. You can see some of the groups that we'd worked with in terms of group homes, the DD population, working with adult care facilities and skilled nursing facilities, congregate care settings, and then also vaccinating seniors in the homebound populations and vaccinating and educating the community. So early on, the vaccines were given to hospitals and to vaccinate the frontline workers, and FQHCs were tasked with vaccinating their staff and the DD population. Next slide, please. SI COAD and MES Communications. A lot of you receive our emails, I'm sure. So we're always updating the latest guidance from DOHMH, the CDC, and other resources. We're also putting out key trainings, events, funding opportunities, collaborative efforts from organizations across the borough. Again, I mentioned our regular email communications that happen weekly, the weekly COAD and MES emails. We also send out targeted emails that when we think there's something that specifically fits certain partners, we will target specific partners or send out specific messages that we think will be useful. Additionally, thanks to Linda Levin, who was mentioned earlier in this call, our intern turned part-timer, we have really bolstered our social media efforts. And I'll talk a little bit later about the Staten Island Stay Strong, Stay Safe campaign and how that's come together with that. But we've also launched call down drills twice a year, as many of you, if not all of you, have received. And the targeted contact lists I had mentioned with those emails. We have our CBO partners that sometimes get messages, our MES partners, those get listserv emails. We stood out, and I'll talk about the ambassador network, and we send them emails, as well as the COVID-19 vaccine task force, our community-led efforts that are often really, really active on social media, as well as always trying to loop in our elected officials. Next slide, please. So talking about our community ambassador program, we have 70+ community ambassadors throughout the island, cross sector, and its organization leads across the sectors. We recruited these key contacts from across various sectors, identifying gaps from our summer 2020 to serve as to have them serve as community ambassadors. So they're people who work in emergency communications, mass care, emergency assistance, housing and human services, health and medical, fire, public safety and security, transportation, city agents, have them work as nodes and amplifiers in getting messaging communication out so that we can act as a borough-wide network for people to access information and resources. Our goal is to do just that, amplify information, get resources out there, make sure that emergency response is tight on Staten Island. We have ongoing targeted communications and periodic meetings with our community ambassadors in many forms, and we want to make sure that we're keeping our lists updated. Next slide, please. So hosting and co-hosting town halls, community conversations, educational webinars. Again, many of you have attended these. We've partnered with many of you on these. So partnering with our CBOs and HC organizations on town halls, targeting specific populations and communities, especially as the vaccine has rolled out, making sure that we're addressing different communities and how the pandemic has affected different communities. We've, over the course of, since July 2020, we've had over 400 participants at SINFPA and COAD programs. Specifically, I'd like to call attention to our town hall that happened in February. We had over 100 attendees, community leaders, and community members involved. It was an opportunity where we had presenters from all different sectors, different walks of life. We had elected officials, DOH/MH physicians addressing vaccine hesitancy, community representatives and faith-based leaders discussing our resources and messaging. And the big thing about this was it was pretty early on at that point to have this many different, to have this diverse group of leaders addressing the vaccine. Next slide, please. I'll talk a little bit about our borough-wide needs assessment surveys and the PPE distribution. So we launched a survey to determine the organizational needs and level of urgency on Staten Island, and we assessed what PPE info, trainings, and other resources our community partners needed. And through that distribution that occurred on April 12th, we distributed 3,000 KN95 masks. 12,600 KN95 masks, 3,000 cloth masks, and 1,200, a little over 12,000 face shields. And since March 2020, we have distributed over 113,000 KN95s, over 58,000 3-ply masks, 3,000 cloth masks, over 31,000 gloves, and 105 gowns, 25,000 face shields, and 24 gallons of hand sanitizer. So lots of PPE distributed. We're always in the process of continuing our assessment of needs distribution throughout the borough, and we're thinking of creative ways to make sure that we're getting our PPE distributed. Next slide, please. The Staten Island Stay Strong, Stay Safe public messaging campaign. I'm sure that all of you have heard me talk about it. Again, that's our hashtag up there. Feel free to check this out on all social media platforms, particularly Facebook and Instagram, where you can see where not just we have posted with that hashtag, but a lot of community partners, a lot of community members from Staten Island have posted with that hashtag. And we encourage all of you to use it when posting anything COVID-19 related, vaccine related. Feel free to co-brand with your hashtags that you might use. So this public messaging campaign launched in November as an educational and outreach effort to keep the borough safe from COVID-19. We wanted to push out information about the Core 4, making sure people got tested as that was more readily available. And then again, as the vaccine rolled out, it became very, very focused on the vaccine. And so we've partnered with a lot of our nonprofits, schools to adapt messaging and share things out on social media. Again, check out our toolkit. I've always pushed this toolkit out. We can drop that in the chat box if it's not dropped already, but we are always adding to this Google Doc. Next slide, please. And the next slide is actually going to be an example of how some community partners have joined us. There you see some posts on Facebook from person-centered care services, and United Activities Unlimited, where we've used our I got the COVID-19 vaccine because ... printout. United Activities Unlimited, their participants have been really phenomenal in creating content for us to post to social media and them cross-posting and sharing as well. So talking a little bit about the COVID-19 vaccine task force, we launched this very recently in May, and it was a coordinated effort by the Staten Island Borough President's Office, the COAD and Mayor's Coalition, of course, the Staten Island Not-for-Profit Association, and Staten Island Partnership for Community Wellness, SIPCW. It's a borough-wide communication, coordination, cooperation, and collaboration effort to increase our vaccination rates. We have some very specific goals in mind in terms of lowering the amount of positive cases and also increasing the number of vaccine rates. So from that has stemmed two working groups, one focused on pop-ups and creative partnerships to make sure that we are increasing the vaccination rates, and the other one making sure to focus on vaccine trust and messaging to decrease that hesitation. Next slide, please. The school and community vaccine pop-up clinics. So this works hand in hand with the vaccine task force working group around this. Sharmila and Dr. Ginny have worked tirelessly creating pop-ups with schools, pharmacy partners, and providing vaccines for youth as well as their families and friends and trusted at a trusted site. You know, it's great for people to show up to a school where they feel comfortable getting vaccinated or a pharmacy where they trust someone. Next slide, please. Oh, and actually now I'm going to hand it off to Linda Levin, who can talk more about our social media analytics.
Thank you, Frank. It's always great to remember how much we did this past year. Kind of to that point, as you see how much we have done, when I came on, I just really tried to bolster all of our many programmatic efforts, as well as our information that we were giving out, because it is so important. So specifically, I kind of gave us a social presence in our analytics that I kind of tracked throughout the year. When I came on in September, it just shows from June to June of this year, we've grown on Twitter by 67 people, Facebook 323 people, and Instagram, the not-for-profit did not have. So that is brand new, and we have 306 people that follow us there. Overall, across all of our platforms, the organization has had an 1100% increase of followership and engagement. Specifically, you can see that on our Twitter, we reach over 68,000 people that see our information and have engagement with our posts. And this is just amazing to many of you that kind of retweet and all of that. Like Frank mentioned, our Staten Island Stay Strong, Stay Safe toolkit, we've had 1,206 people that have utilized that. We thank you for that. And our hashtag has been used over 1,000 times. I have Excel documents that I track. So thank you for using it. But it's definitely fun to track everything in every post and what organization does that. So thank you. And I just want to let everyone know this is actually all through organic growth. We have not paid for any marketing. We have not utilized any special tools. This is just through our collaboration and cooperation, like Frank mentioned, and all of our amazing partners. I would like to ask you all, if you have your phone, to please unlock, open your camera, and you can please add us on our Instagram, Twitter, and Facebook if you want immediate access to any of our programs that are coming up, any grants and the vaccine pop-ups. This is where you're going to get that information immediately. So Instagram, Twitter, Facebook, just open your phone, open your camera, and just scan it and it'll pop up, and then hit follow. So thank you.
Thank you so much, Frank and Linda. I'm going to leave these up as I introduce our featured guest today to deliver some remarks, Dr. Ginny Mantello. She is no stranger to this community, to this borough, beyond as well, New York City. I honestly have the great privilege of working with her, as well as the team that comprises the Staten Island COAD and medical ecosystem. She has been indeed a leader in this work, in bringing together our multiple sectors, multiple organizations, and businesses and elected officials to really, really take this pandemic head on and not only do what's needed, but go above and beyond to create and develop and partner to put out innovative solutions and test ideas. It's been such an honor to work in partnership with her and her team and to meet all the amazing people she's brought to this work collectively. So I am very pleased to introduce Dr. Ginny Mantello, the Health and Wellness Director at the Office of the Staten Island Borough President, who, as well as many of you know, has been an incredible partner with the COAD since day one. We shared a lot about that at our annual meeting last year, standing up an incident command team and a virtual EOC, Emergency Operations Center, with the Borough President and his team. It was invaluable. Dr. Mantello is going to share a little bit about where we are today and getting beyond today. Dr. Mantello, are you on and can you share your screen? I know I have a poll to launch as well.
Hi, good morning. Yes, I am on. Sorry about the delay in joining because we have a new computer system and it decided it had to now double authenticate my logging in. And so I had to set up an authentication on my phone. And well, it was a little harrowing to not be able to get in, but here I am. So good morning.
Thank you. Great to have you here. Did you want me to start the poll before you get started? It's just a couple of questions.
Sure. Absolutely. Whatever works best for everybody, whatever works best. So.
Okay.
Yeah.
Great. So these are a few questions. Do you see them on your screen? Does everyone see them? Great. So there's a few questions here that Dr. Ginny drafted to help give her some perspective on how our organizations, how our communities are doing right now, and they'll help shape her conversation with us, which really, one of the things she said to us is, I have reflections and I have things to share, but what she's really interested in doing, in addition to sharing lessons learned and best practices, is hearing from some of us. So if any of you want to share questions, thoughts in the chat box, you can feel free to do that. To everyone, or to Linda, Frank, or myself specifically, so that we can keep track of them. And yes, our board chair, thank you for reminding us that we should and can be tweeting about this. We are on Twitter, and in the chat box is our feed. Feel free to tag SINFPA, the SI COAD, any of the individual organizations on this call, and of course, the Borough President's Office. Okay, I'm going to end the polling so you can see where we are. Do you see the results? Okay.
We can.
Great. I'm going to go to the next, whoops. Go to the next poll. Can you see the second question?
Now we can.
Okay. And again, if you have thoughts or comments, you can feel free to enter in the chat box as well. Almost trying to get us to about 70% here. All right, I will share the results in just 1 second. Okay. Does everyone see the results?
Mm-hmm.
Okay. And then we have one additional question. How ready, comfortable are you? Sorry, I should be reading these. Are you returning to work fully in person? And, we're asking to answer even if you are currently back, because we have anecdotally heard that, some people have resumed operations, but it's leaving them with some concerns. And of course, please use the chat box to share any specific questions or concerns as well. You can see the results here. 57% are very comfortable, 20% are comfortable, 11% neutral, 11% uncomfortable. Okay, Dr. Ginny, take it away.
Great. Thank you. And hi, good morning, everyone. Can you see my screen? Great. So as I was, and thank you, I want to start off by really thanking Sharmila, not only for the wonderful partnership and the incredible work that's happened that you heard some of, previously when Frank spoke and some of the other speakers, which I might have missed, but also thank you for the invite to her and the Staten Island Not-for-Profit Association. And I am absolutely thrilled to be here this morning. Hopefully I could give you a little bit of a perspective. I do want to try to focus more on the positive, but I would be remiss if I didn't talk a little bit about the past. And then, of course, I want to end with what we think might be in the future. And yes, we know we don't have all the answers yet. And I think most of you know that. But hopefully this morning we can spend a few minutes. As Sharmila mentioned, I wanted this to be a little bit of a dialogue. I do want to hear from all of you. I also want you to think about ways that you could work with us, help us, and how can we partner and collaborate. So in thinking about the past 15 or 16 months, I think that we all have felt a tremendous strain. It's been incredibly grueling, incredibly challenging. There's been so much pain, so much suffering, so much loss. And the mental health impact of this pandemic, we haven't even seen the tip of the iceberg yet. And we know that there will be many, many more months and many years of us trying to recover. And when we think about the loss, we really we should think about the fact that it's okay to grieve. We've had loss of loved ones, loss of family members, loss of friends, colleagues, loss of jobs, loss of homes. For children, they've had loss of just being able to see their friends and play together. Loss of proms, loss of graduations. We've also seen a tremendous increase in food insecurity and hunger and almost tripling of the food needs. In addition to all of this, we've had exacerbations of racial inequities. We've had politicization of basic public health measures like mask wearing, and the list goes on and on. So it's certainly okay for us, not only to reflect, but also to think about the grief we've gone through. It's okay to grieve, and it's certainly okay to take some time off and think about our own mental health and our recovery. So in terms of the positives, and I said that's really what I want to focus on today, we also have to think about the incredible outpouring of love. It's been a community that's come together, stories of resilience, stories of, people, restaurants sending food to healthcare workers in spite of not being unable to make their own ends meet, the daily or nightly clapping for healthcare workers, so much support. We've seen endless stories, neighbors helping each other, people volunteering to bring individuals to the vaccine sites, churches, pastors, everybody stepping up to host vaccine pop-ups, of course, doctors, nurses, EMTs, helping in every which way they can, working round the clock, and it still continues. So many have taken no break. So again, as I said, I do want to focus on the positives, but I want to talk about what's happening now and about a city that's reopening, a city that, how is all of this going to impact you and your business? So while we have a lot to celebrate, and some of this I'd like to talk about and set the stage in terms of where we are with the data, how we're doing with the vaccinations. While we do have a lot to celebrate, I do want to caution everybody that we're not yet at the finish line. we still have a lot of work to be done. And that's part of the challenge. Think the cases are going down, the rates are going down. We're doing incredibly well, but at the same time, we cannot forget that we saw similar numbers improve last year. And we want to make sure, because the virus is not gone, we want to make sure that as this virus tries to keep finding hosts and tries to resurge in the fall and the winter, that we're already protected, hopefully with the vaccines by then. So we recently, the governor announced that most of the remaining COVID restrictions will be lifted when 70% of adult New Yorkers have received the vaccine. And what does that mean? So I don't know if many of you have seen some of this that's been outlined by the CDC, the New York Move Forward, but I'll be sharing some of it and actually trying hopefully to simplify it a little bit for you today. But really what they're saying is that they're lifting most of the capacities, that the social distancing, all of the restrictions that were previously laid out will become optional. And unvaccinated individuals will be responsible for maintaining social distancing and mask wearing. So nothing has changed for them per CDC guidance, but per CDC guidance, for those that are vaccinated, they no longer need to continue the social distancing of 6 feet and wearing masks. And we'll talk about that. And of course, there's exceptions to this, large scale venues, pre-K to 12 schools, public transportation, shelters, correctional facilities, high risk areas like nursing home and certain healthcare settings, and they have to still adhere to the existing COVID-19 protocols. We also know that the milestones, the recovery milestones, have been tremendously improving. Now, this is wonderful news, and it's certainly something to celebrate, considering that at one point, New York had the highest COVID rates. And then we also know that after doing tremendously well last year in the summer, we had a pretty significant resurgence post-holiday. So since January, we can now celebrate that we have a 95% decrease in new COVID cases, a 91% decrease in positivity. The current state positivity is down to 0.5%, and that's been declining 65 days consecutive. I see there's a typo there, consecutive days, and lowest in the country. New York City rates are also below 1%. And when Staten Island has traditionally had a lot of the higher positivity rates, even we have gone down significantly and lower than previously. And only a few of our neighborhoods are above 2%. 10303 is an example. And then there are some neighborhoods between 1% and 2%. So we're doing really well. And so we're also seeing a marked improvement in hospitalizations as well as a decrease in hospitalization, which is all wonderful, but makes our work harder, because the more, the less the number of cases, the less likely people are to think there's a problem and to think that we are at herd immunity, which we certainly don't think that we are in terms of looking at the science. So this is just to show you where we were last year and then how we had really gone down. This was early on in March, April, May, when we saw a tremendous rise in the cases and deaths. And then we really came down in the summer, and it was only in the fall, October, November, that we started to see cases rise. And then January, February was the peak of the post-holiday. And now you could see we're back down very low, as low or lower than we were last year in the summer, which again is great, but we know that the virus has not really gone away. So just to shift gears and talk a little bit about vaccinations and vaccination rates. Globally, there's 2.75 billion with a B doses of the various vaccines that have been approved by the WHO that have been administered. So that's something to really think about and reflect. Almost 3 billion people have had the vaccine. And it is important when people talk about safety. And in the US alone, almost 300 million doses have been administered. So 50% or 51% of the US total population has received at least one dose, and 41.2 are fully vaccinated. Now, I know there's lots of numbers being thrown out, and the numbers that the Biden administration is using, as well as the governor, is looking at the adult population. And that's fine, but as long as you're aware of where that number came from, these numbers that I'm showing you is total population. And the reason I'm doing that is in order to achieve herd immunity, you really have to think about the total population. You do have to take into account that there are certain percentages of the population that are unable to get the vaccine. Right now, children below 12, as an example, are unable to get the vaccine. There are many people that are also, for medical reasons, cannot get the vaccine. And those are not large numbers, but there is a small percentage. There's also percentages of people that are immunocompromised that may not be able to have the full effect of the vaccine. So they're only partially really protected. So you can see that, the state is doing a little bit better than the US population averages. The city is doing better. But let's talk a little bit about Staten Island for a second. So early on, when the vaccine effort started, Staten Island was doing really well. And we were really neck and neck with the city in terms of percentage of people vaccinated. But for the last few weeks, we've really fallen behind. And there's a few places that, like Manhattan and Queens, that have gone ahead. And we have Brooklyn catching up, also close behind. So 48% on Staten Island have received at least one dose, and 42% are fully vaccinated. Now, just to reflect on that for a second, if 42% are fully vaccinated, that means there's 58% that are not fully vaccinated and that are still at risk. So we have to think about that. And even though the numbers are going down, we really, really need to encourage people to get vaccinated. If we are not vaccinated, then we need to look at the science, we need to get guidance, we need to get comfortable with the vaccine, we need to talk to our doctors, we need to talk to those that have been vaccinated, and we need to continue to look at some of the data and the side effects if you're concerned about. And again, I say that, the reason I show all of these numbers is not because I expect you to remember them, but I just want to give a larger picture of how many people out there that have been vaccinated. Also, we know historically that any vaccine that has been created, if there was a major side effect, it would have taken place within the first 6 to 8 weeks. And we know that the mRNA vaccines have far exceeded our expectations, not only in terms of efficacy, but also safety. And these are some of the safest and most effective vaccines that have ever been created. So again, I mean, my job here is not to tell you all to get vaccinated. My job is hopefully to empower you with the knowledge, and so that you can make an educated and a comfortable decision for yourself and your family. So if you're not vaccinated, I do urge you to speak to people that'll help you understand and help you get comfortable. If you are vaccinated, then I urge you to go out and talk to your family members, your neighbors, your friends, and your community, because we need to help each other. And it's, again, this is not just about each individual person. It's a global pandemic, and each and every one of us across the globe are impacted. And until we get the majority of the population across the globe vaccinated and protected, we're not going to see the end of this. So we're doing well in terms of over 65 years, and 78% have received one dose, and 72% have received fully vaccinated. And this is just some graphs from the health department data showing you the vaccination rates. Here you can see by race, ethnicity, as well as by age. And again, I just wanted to point out that the most vulnerable population and the one where we saw most deaths, we have about 75% of them vaccinated. And you can see that there's many young people that are starting to get vaccinated, but certainly there's lots of gaps there as well. And you can see when it comes to the vulnerable communities, the Black and brown communities, that the vaccination rates are very low. So I'm not going to dwell in terms of the vaccine on what's available. I think everybody's really well aware of the Pfizer, the Moderna, Johnson & Johnson, the 1 dose, the 2 dose. Basically, just to mention that all the vaccines that are approved by the WHO would be adequate for you to be qualified as being fully vaccinated as long as you are 2 weeks post to the second shot and 1 week in case of J&J. Also, just really quickly to mention that there's many studies underway, not only in children, both for Pfizer and Moderna, but also in looking at pregnant women and certain subsets of the population. And also there's many rigorous trials going on across the board for younger children under 12, and Moderna will soon be submitting for emergency use authorization 12 and up. So with that, I want to sort of transition and talk about reopening for not-for-profits and businesses. So you may have seen that effective May 19th, New York adopted the CDC's public health recommendation for fully vaccinated people, which was issued May 13th. And now New York has also put out a New York implication guide. So, and I, understand that there's a lot of confusion, and it's I wish there was an easy answer. One of the things I do want to tell you that as businesses, you have seen a tremendous amount of loss in terms of revenue. It's been a very challenging past couple of months, but unfortunately, all of us are going to have to make some tough decisions when it comes to reopening. And really, the only limitation at this particular point for most businesses to make a decision is really on availability of space and comfort level, individual comfort level in terms of how many, and part of why we were asking the question on how many are vaccinated and your comfort level is really those are sort of the only things that are important when it comes to making the decision in terms of reopening. And so just to summarize it in a very simple way, that the requirements for social distancing and masks remain the same for any staff as well as customers or constituents that are unvaccinated. So you still need to continue and both are required in an indoor setting, mask wearing and social distancing if you're unvaccinated. So for businesses, the first decision that you need to make is that for those that are fully vaccinated, now the CDC has said you do not require masks and social distancing, but you do have the option to require them if you choose as a business. For instance, if you are limited in space or 6 feet distancing isn't possible and coworkers are not comfortable being close together, you may choose to require masks for all people, including those that are vaccinated. The other decision that you need to make is, can you rely on self-reporting or the honor system, which the CDC and the state is saying that is up to businesses to either require proof or not require and go on the honor system. So that's the other decision you need to make. Can you rely on the honor system for employees and customers? Or if not, can you require proof of vaccination if you choose? And finally, if you are in certain settings, like where you are over 250 people indoors or 500 outdoors, you must require proof of vaccination in those large settings, as well as certain high risk and congregate settings, which I laid out previously already. So yes, it's confusing, but these are decisions that unfortunately businesses are going to have to make over the next few months as they start to bring their staff in and allow for business as usual. Now, everything in life is a balance, and right now we're at a point where we have to pick and choose and really think about balance. So we do want the city to reopen. We want things to go back to normal. We want to go back to pre-pandemic. We want to believe the pandemic is over. Unfortunately, the pandemic is not over, And we really have to think about that, but we want to come back and make the best, most educated decision, and also keep each other safe in those decisions. Of course, everybody's aware of the vaccine passport and the Excelsior Pass, and you can use this to, go to your favorite venue. You can have it on your phone, and this is digital proof that you've had the vaccination, and you can download the website. And I can share all of these links with Sharmila if you don't have it. You can attend sporting events, arts and performances, theater, and a lot more. So you can get it digitally, and businesses and venues can now scan and validate your pass to ensure that you have had the vaccine. Again, I wanted to share this really quickly, that the governor also had shared 2 days ago about proposed legislation to waive taxes on funding for small businesses. And there's applications open June 10th, as today actually, of grants up to $50,000 that will be available for small businesses to apply. So that brings us to what's to come. So I want to really talk for a second and then open it up to questions to really think about what's on the horizon. So we know that there's variants. I talked about this. I talked about herd immunity. And we also know that there are many countries, many parts of the world that are, even though globally the cases are going down, there are some countries that are still seeing an uptick in cases. And many countries have used different approaches. Some countries, like England and Canada, for instance, decided that they would rather do one-dose vaccinations for larger groups of people than try to fully vaccinate people. So but that you run the risk that if there's a more aggressive version, and an example of that aggressive version is what we saw in India, or the Delta variant, that can really take foothold. And we saw lots of people in India and also now in England and Canada that are still getting infected with one dose of the vaccine. So the question was, they had to make this tough decision to decide, is it better to have less people fully vaccinated or more people partially vaccinated? It's also important to understand that the first vaccine dose provides about 80% protection, but you do need the second dose to get you that over 90% protection, and also for the immunity to last, because most of the studies that have been done with 2 doses of the vaccine. So there are many variants of concern that are already out there. There are variants of interest. I will tell you that the variants that we saw early on, the strain of the virus that we saw early on last year, March, April, and May, is almost non-existent currently in New York. We have a lot of the UK variant, or the B.1.1.7. We also have a lot of, we're starting to see a fair number of cases of the Brazil variant, and we have our own New York variant. And people need to understand that this is what the virus likes to do as it spreads from host to host. It likes to morph itself, and that's how variants start to emerge. And that's why I keep emphasizing the fact that in order for all of us to be protected, we have to make sure that in order to end the pandemic, that we get most of the people globally vaccinated and protected. I know that things are opening up and people want to travel. I caution people from traveling overseas, because we certainly don't want to go overseas where there's still risk, and have the risk of picking up some variant that is not existing in the United States. In terms of boosters, which is a question that often comes up, I do want to mention that Pfizer and Moderna have already started to vaccinate people with the 3rd dose or the booster. There are definitely a lot of studies going on. More than likely, we're going to need a booster. When that is going to be needed is unclear. The vaccine passes are good for a year. And we have data now since phase 1 of the trial, and phase 3 of the trials started last summer. We know that we have almost a year worth of data to show that there's protection and there's immunity. We don't have data beyond that. So by fall and early winter, we'll have a good sense of the boosters and when we need to take them. So again, lots of information and a lot of reflections. I certainly hope that that all of you as trusted partners can think of what role you can play in our community, certainly to spread the message of to people to get vaccinated. And then also perhaps think of ways that we can incentivize folks to get vaccinated. I'm doing a lot of work in different sectors like group homes and nursing homes, thinking through creative ways of creating vaccine champions, not only in their sector, but we need to be thinking about creating vaccine champions for our community and helping those that are most vulnerable. So I think the bottom line is that we have a lot to celebrate. We've done a lot of work. We've seen a lot of pain, a lot of suffering. We need to spend a lot of time on our own mental health, and we need to spend a lot of time to recover. But at the same time, we cannot let our guard down. We still need to be careful. We need to make difficult choices. We need to continue the core four. We certainly need to protect each other and the most vulnerable populations. And most importantly, we need to work together as we have done in the last 15 or 16 months. So with that, I'm going to stop and take any questions or any thoughts and on how we can partner moving forward. Thank you.
Thank you, Dr. Ginny. This was excellent. I'm getting some texts and chats on the side. I think this was answered, but it's come up a couple of times. The Excelsior Pass not really working. Is it sufficient and acceptable if someone asks to show them a copy of it on our phone instead of carrying a hard copy?
The actual vaccine card.
Yes, I'm sorry. Yes.
Yes. Yes.
Okay.
You can actually not only, so there's two different things. The vaccine card is what was physically given to you after you finished 2 doses of your vaccine. You can take a picture of your card. You can laminate. There's a lot of places that are laminating it for free. Staples, for instance, was laminating it for free. And it would be advisable for people to carry it. But the Excelsior Pass is something you can download on your phone. And all you have to do is go on the app and actually just the last dose of when you were vaccinated. It asks you a number of questions. For example, it asks you when did you put in your name and your information. When did you take your second dose? You put it in, and then it asks you certain verification questions. What vaccine did you take? What was the site that you took it at? It gives you a number of options. And once you authenticate, this is data that the state has already. Once you authenticate that, it actually gives you what looks like a QR code, a large code, and then you can save that on your phone. And that is then proof that you've had your vaccine.
So 2 things, and then we have a question from one of our participants. I was told not to laminate the card because, well, first you need your second shot, but now we may have boosters and there's additional lines on there. So that's why I've been telling people don't laminate it quite yet. And then the other piece about the Excelsior registration, and Carol, I don't know if this applies to you. I learned yesterday that some people are having trouble finding the site. So I got vaccinated or my kids got vaccinated at a school, but it's not the school or HHS, it's the pharmacy that administered the vaccine. So sometimes that hiccup is causing people to have problems. We heard that on our T2 cab call on Tuesday.
Yes, yes. So remember that it depends on where the pharmacist put in, as the site, right? Because he's the one that's presenting the data to the state.
Right, right.
If he put his actual pharmacy address as the site, and that's what you would have to put in.
So for CBOs that are assisting their clients and partners to get vaccinated or hosting pop-ups, this would be something to make a note of, clarify, and have on hand to share as information or a resource with those that you're getting vaccinated. Janice Munger, did you have your hand up? No, okay, sorry about that. Anyone else have comments or questions for Dr. Ginny?
And certainly thoughts about how we can, partner to work together if we haven't done so already. And I know that we have partnered with many, many people already that are on this call, but any creative thoughts on how we can partner to work together to improve vaccination rates or any other concerns that are coming up, through your staff and constituents?
Hi,
I have
Sheila.
Please, I have a question for Dr. Jenny. My name is Night. So yesterday, I learned that France Prime Minister wife had been had been detected positive, but the prime minister was vaccinated earlier in the year. I didn't understand how that works. Can you maybe explain what caused that and how that can happen? We are very anxious about that.
So just if I understood your question correctly, you're saying that the prime minister's wife tested positive in spite
Yes.
of the fact that they were vaccinated. Is that accurate?
Yes.
Okay. So this is so just because you have been vaccinated. So remember number of things. So and I don't know which country, well, whether you're referencing, but there's different vaccines that are being used, and different vaccines have different efficacy, and none of them are 100% protective. I will say Pfizer and Moderna have shown in trials to be 100% effective in children, but in adults, studies that actually the CDC yesterday showed that looking at the data of millions of people that are vaccinated, the protection is about 91% Pfizer and Moderna. But J&J, for instance, or some of the other vaccines that are being used in other countries are only in the ballparks of 60 to 80% effective, which means that there's still a risk of getting COVID. B, the other thing that I want to just add is that even for those that have been vaccinated, there is always a possibility of getting COVID in a mild version. So when we talk about efficacy of a vaccine, and all three that are being offered in the United States are 100% protective in severe illness, hospitalization, and death. So that doesn't mean that you cannot test positive after getting the vaccine. And an example that comes to mind is when we had 9, I believe, Yankee players who had received J&J tested positive. And the reason for that is that you can still test positive. It's unusual, but so they one of two things: either they were in the 25 or 30% that was not protected, or it could be that they just ended up with mild or asymptomatic disease and tested positive. So I just want to, it's important when people say they got the vaccine and test, and there's also, so vaccine breakthrough does occur, where you can get a positive in spite of being vaccinated. But for most part, people that have been vaccinated either end up with mild or asymptomatic disease. And they certainly, I haven't heard of people getting, in the US, getting severely ill or hospitalized after or dying after the vaccine. Now, again, as I mentioned, there are many different vaccines in different countries, and certainly there might be cases where it did not protect you because it just wasn't effective in your case.
So I think we are going to direct people to contact the staff.
Thank you, doctor.
My pleasure.
Yes, thank you for the questions. I know that there are others that we will answer via email. Thank you, Dr. Ginny, for being here. There are lots of efforts happening around the borough to tackle some of the questions that Dr. Ginny has up on the screen. You can contact Frank or myself. Our emails are in the chat box about some of these task forces that we have and how your nonprofit can partner with the efforts across the borough to help increase vaccination rates. And there'll be a survey after this meeting as well, where you can share additional ideas. Thank you so much, Dr. Ginny, for being here. I know you have a very busy day, so we're grateful for your continued partnership and all the wisdom and guidance that you get to share with us each and every day.
It's my pleasure, Sharmila. Thank you to all of you for the amazing work, and thank you for having me this morning.
Excellent, excellent, great. Okay, so we are going to move. Thank you for sticking with us as we're a little bit behind, but we are going to move into our committee reports now. The first being our governance committee report. And before I turn it over to our governance. Whoops, that's not what I wanted. Our governance chair. I just wanted to take a moment to acknowledge 2 board members that have been with the association for several years that have moved on. Many of you know that Eileen Shumard-Fuchs, former CEO of Snug Harbor, has moved to Washington, D.C. and is heading up the National Building Museum. We are very thrilled and excited for her, and just wanted to take a moment to acknowledge all the time and effort she has given to help SINFPA get where it is today. She's been a true partner to the organization and to our community in leading Snug Harbor. And to Afua Asamawa, former CEO of Pro Youth, she as well is still here, but has moved on to some other work that she's doing in the community and with youth, and so has stepped off the board at this time. And so I don't think they're here today, but we will ensure that we acknowledge them as well, and just wanted to give a moment to thank them for their time in serving with the association. Jenny, I'd love to pass the so-called baton to you to give our governance committee report and move on to our election results.
Hi, thank you. Can you hear me?
Yes.
Okay. So on behalf of the Board of Directors, the Governance Committee is pleased to announce our election results of this year. The Governance Committee's responsibilities are mostly around governance with the bylaws, as well as the incoming and outgoing board members and the slate of officers for the board. So the existing board members vote for the re-election of existing board members and for the slate of officers. And for new board members, they are elected by the full association membership. So today we are giving the opportunity to all of you at the meeting today to vote, or to at least voice any concerns you might have. You can put that in the chat either directly to me or to Sharmila or to Adrian, our board chair. So in terms of our board officers, Sharmila, can you do the next? We are re-electing our slate, and that would include, for the position of chair, Adrian Abate from Staten Island Partnership for Community Wellness. For the position of vice chair, Carol Bullock from the Staten Island Pride Center. For the position of secretary, Mary Cottingham from the Integration Charter Schools. And for the position of treasurer, Sam Farag from SCORE. In terms of our board members who have completed their term but are continuing with another 3-year term, we have re-elected 2 board members, Carol Bullock from the Pride Center and Arlene Sorkin from Illuminart Productions. Excited to have them continuing. And in terms of new board members who are very excited to get to know and to welcome into our community of board members, I'll introduce each one, and then if each one of you wants to just, you don't need to give any formal remarks, just say hello so we can see you appear on the screen if you're here. Chaplain Hallie Bonner is the Director of Equity Inclusion at the New York State Chaplain Task Force. Holly, are you here?
I am. Hi, everybody. Thank you very much. I'm very excited to work with all of you, and it's a pleasure to be in the meeting with you all today.
Thank you so much. We're excited to have you. Gabriel Delmonico is the President and Executive Director of A Chance in Life, expanding their services onto Staten Island.
Hi, everyone. Me too. I'm very happy to be with all of you today, and I'm at your service. Thank you so much for this opportunity.
Thank you. Welcome. Yesenia Mata is the Executive Director of La Colmena.
Hi, everyone. I'm really happy to be here with you all and excited to be part of this board.
Thank you. We are excited too. And Janice Monger is the President CEO of Staten Island Museum.
Hi, everyone. Thank you so much. Looking forward to serving in this capacity.
Well, we're excited to have all four of you join the board. It's always exciting to have new voices join, new energy come join our discussions and our thoughts about how to support the Staten Island not-for-profit and how to move it forward most effectively. The board terms are generally 3 years. We have the new board members I just mentioned coming in for 3 years. We have 2 that were reelected for 3 years. We have a whole slate of people who were either renewed or joined last year, and their terms are ending in 2023. That would be Laura Dellin, Linda Dianto, Samir Farag, John Malizia, Candice Gonzalez, Agnes Kamara, myself, and Frederick Stefani, and Orit Lender. And then we have a few that are going to be completing their terms in 2022. That would be Adrian Abate, Mary Cottingham, Joanne Gerenzer, and Eileen Peppert. I think that would conclude, I believe, my report for the governance committee. I don't know if anyone has any questions.
So I should say thank you, Jenny, for that report and helping us welcome in our newest board members. Last year, we were doing this for the first time, and this year we did put out a ballot. And so we had, I want to say, almost all, but not all of our members cast their vote on our electronic form. And so we tried something new, and we're very excited to welcome all of our newest board members. Yes,
I'm
sorry.
so sorry. My screen was a little cut off, and David Sorkin, I'm so sorry I missed that last line. But we do have an honorary advisory board member who continues to provide a lot of sage wisdom and advice and collaboration. So I do appreciate your participation in that. It was only missed because it was cut off on my screen.
I was going to say the other thing that we did last year for the first time, and which we're allowed to do according to our bylaws, is to have advisory board members. So as the governance committee continues its work in looking at our bylaws, and you'll see this as one of the activities on my year in review, we'll be looking at recruitment and retention and diversifying our board, as well as updating the bylaws. So thank you to our governance committee, which also comprises Adrienne Abadi and Orit Lender. We you guys had a lot to do this year, so we're thrilled about that. I also want to take a moment to recognize and give some gratitude to our SI COAD and medical ecosystem co-chairs, some of whom are on the call. You already heard from Dr. Mantello, who is one of the co-chairs of the medical ecosystem, and I believe Tina Campbell is also on the call. She is at Richmond University Medical Center, and she also is a co-chair of the medical ecosystem. Could not have gotten through this pandemic without them leading not only the MES, but the incident command team that we stood up. And then, of course, continuing in the role of COAD co-chairs are Shirley Dunn, who is at Eden 2, and Joe Tarnello, who is at Meals on Wheels of Staten Island. The other members of the steering committee that oversees this work are 2 representatives of the SINFPA board, including David Sorkin and Adrienne Abadi. And then we also have Reverend Karen Jackson as a member of the Staten Island Long-Term Recovery Organization, serving on the committee as well. And I didn't get to, because I didn't introduce her, Frank did, but I wanted to take a moment to also acknowledge, during all of what you've heard, the invaluable role that Linda Levin has played here at the association. She joined us through a partnership with the College of Staten Island as an intern a year ago, or less than a year ago. And we've brought her on, as Frank mentioned, as a part-time communications associate. And all the work that you've seen in community engagement, education, and outreach, not only on the COVID pandemic work, but in general, the workshops that you'll hear about next, is really due to the dedication and the innovative ideas that Linda has brought to the table. And we are really grateful for that energy and excitement that she's brought and helped expand our team. So she also serves a role on the steering committee for the medical ecosystem and COAD. I am very pleased now to move into our program committee report. Laura Dellin, who is the chair of the committee, and Arlene Sorkin are going to give us some updates. And then we'll also hear from Carol Bullock on membership and future planning, which the board has been working on through this last year as well.
Hi, everyone.
So,
can everybody hear me okay? Okay, got the thumbs up. Thank you. This past year, since our last annual meeting, programming has continued to take a virtual platform. Since last July through the end of this month, the association, including the Staten Island Co-ed, has put forth over 40 programs and activities. A large focus of these programs was to assist our members through the COVID-19 pandemic, from maximizing organizational benefits during the pandemic to managing stress, reopening phases, into vaccination information. We also offered members the opportunity through partnership with Nonprofit New York to participate in diversity, equity, and inclusion learning lab trainings. We also offered traditional programs on keys to unlocking success in federal grant funding and key employee handbook updates to consider in 2021. We were able to retain our holiday mixer and did it virtual and social platform with Remo for members to be able to enjoy a few hours and network with each other, even though we were still virtual. Our affinity groups have been ongoing, and during the pandemic switched to virtual teas and coffee exchanges with meetings occurring in the areas of fundraising and development and an executive directors roundtable. All of this would not be possible without the commitment of the SINFPA staff, Sharmila, Frank, and Linda, and my thanks to our programming committee and board members for support and outreach. Our thanks to Lisa Bronner, Judy Eisenberg, Todd Cohen, Jeff Finkel at Mutual of America and the Mutual of America Financial Group and his colleagues, and those that we partner with for programs including Lawyers Alliance, Nonprofit New York, Nonprofit Westchester, New York City Emergency Management, New York City Department of Health and Mental Hygiene, Staten Island Chamber of Commerce, Mike Bloomfield at Techie Geek, and most important thanks is to all of us and all of you, our members. Your participation in events is important to us, and you're what makes programming great. So thank you for that. Keep coming to programs. We love to offer them. And now I'm going to introduce Arlene Sorkin, President and CEO of Illuminar Productions and a member of the programming committee, to highlight what is to come going forward.
Thanks, Laura. Can everybody hear me? Okay, good. So good morning. As you can see, we've been very busy throughout the pandemic, and we will continue to provide the most vital information to support nonprofits. Some of our upcoming events, which can be found on our Staten Island NFP Facebook page, if you haven't joined yet, please join, are on June 15th, Managing Benefits and Compliance Changes Going Forward, What Nonprofits Need to Know. On June 16th, Getting New York Nonprofits Back to the Office, and also Biological Hazard and Illness Presentation Workshop. Those are two separate ones. On June 21st is the Staten Island Co-ed General Meeting, where we'll talk about latest on mask guidance, implementing reopening plans, and stockpiling PPE. On June 24th, the Staten Island Information Session, Nonprofit Finance Funds Care Fund, No Interest Loan, and Financial Advisory Services. And at some point, we haven't figured this out yet, but we will begin to offer programs in person, but we're still discussing it. Coming in August, on a date to be determined, we'll have Equity and Belonging on Staten Island, role of nonprofits. In the fall, we'll be launching our Nonprofit Equity and Justice Training. We are very excited to announce that our annual conference will be back on October 21st at the Hilton Garden Inn, so mark your calendars. It's a great opportunity to network in person again, and we will have our usual informative sessions as well as plenty of time to catch up with your colleagues. In addition, we plan to bring back the Community Service Awards in the spring of 2022. This feel-good event is an opportunity for nonprofits to shine a spotlight on our unsung heroes. And finally, I want to mention the free calendar for nonprofits to post events. We developed the community calendar for nonprofits and partners to share major events and fundraisers to get the word out and avoid overlapping events and conflicts in scheduling. So we are really looking forward to seeing you at upcoming events virtually and in person. And I want to pass it along to Carol Bullock, Executive Director of the Pride Center, to talk about membership and our strategic planning.
Thank you, Arlene. Good morning, everyone. I'm Carol Bullock. I am the Vice Chair of SINFPA, as well as the Executive Director for the Pride Center of Staten Island. My pronouns are she, her, hers. So I am on the membership committee, along with Jenny Linton Hirsch and Eileen Pappert. And one of the things that our committee is doing is analyzing our current membership. To give you an example, we found that half of our members currently are in the sectors of arts and culture, as well as education. And then we're also looking at our pricing. We currently have 10 tiers of membership right now based off of budget of organization. And we found that just a little less than half are in the first tier. So we are analyzing that as well. We have started strategic planning, and these are what you see on the slide right now is a lot of what we discussed and came up with as a group, talking about what we'll be doing in the future as far as the organization goes. So I'll quickly run through these. Diversify funding sources. I think that's something that probably every nonprofit is constantly thinking about. Create leadership development activities, DEI and social justice trainings. We had one already and the feedback was just amazing. So we will continue with those. Explore pooled and shared resources with other organizations, for example, the Chamber. Marketing opportunities. Continue to be a source for training and best practices in not-for-profit issues. Create capacity building activities and programs. Develop programming for very small as well as very large not-for-profits. And this is really where we work closely with the programming committee to make sure that all of the programs that Arlene and Laura just talked about suit the needs of all of our members. Create strong advocacy for the needs of Staten Island. Let me say that again, Staten Island not-for-profits. I think that we all know that resources are not evenly distributed out here to Staten Island. Assist members. I cannot see my slide, I'm sorry. Bear with me, I'm sorry.
Is it because of the caption? Is it because of the captions, Carol?
It is, yes.
Okay.
Sorry about that.
It says, do you want me to read it? And then you can take it from there. Assist membership in board recruitment and training.
Yep, got it now, thanks.
Okay.
And peer engagement activities. So our affinity groups, we've been doing those in the past, found them to be really great, and we'll continue doing those as well. So we have committees who have been put together, are working on all of these things, and I think between all of the programming and the direction that SINFPA is looking at all these opportunities, it's just amazing things for the future for us. Thank you.
Thank you very much, Carol, Laura, and Arlene, for talking about what we've done and what we plan to do. We have grand plans. You know, the pandemic did sidestep, and me being new as well, some of our goals from last year, but we are very much looking forward to working with our board, our volunteers, and you, our members, and our other partners in Staten Island to really get back on track. And so with this, I also want to put a call out there for all of you to join any of our committees. You'll get a survey after this meeting, but you're also welcome to email me at sharmila@sinfpa.org. As we start planning for the conference, there'll be a call for ideas, a call for sessions, a call for volunteers. So we hope that you will stay tuned at our communications and join us. We have this meeting going until 11:30, and we know that not everybody can stay on. So before we're gonna formally sort of conclude and then move into breakouts for those that want to stay on and do a little bit of peer exchange with your colleagues that are here. I wanted to take a moment. I mean, you've heard a lot of gratitude today, and really none of us could have gotten through this past year plus without the collective care, action, partnership, collaboration, coordination that we have experienced. And so in addition to the work with our members and our board, who has been incredible, I joined as in this role right before the pandemic, and they have been gone above and beyond. They all serve their own communities, their own organizations in leadership roles, and they have never hesitated to respond to my asks and my need for guidance and assistance. And that's a really that's how a board should be. But they really did go above and beyond this past year, as well as all the volunteers in our COAD and SINFPA community that helped fundraise for supplies and help do supplies distribution with Frank and myself and the COAD and MES to all of our frontline providers, social service and nonprofit organizations throughout this year that needed this. So on the screen, you see, you know, I think we did a pretty good job, a comprehensive list of our sponsors, our volunteers, our supporters, our partners, our donors. For the first time in the last year, SINFPA launched a fundraising campaign, and we raised nearly $30,000. Most of it went to support relief and recovery efforts in the form of PPE and supplies for your organization. So that was really exciting this past year. I'm not going to go through this whole list, but please take a moment to read all of them. And again, they'll be in the deck that you receive or that's in the chat box as well. Are there any comments or questions while we take a breather for a second? I was going to launch a poll. Anyone have any thoughts or comments that they'd like to share at this time? Okay. So I was just going to launch a quick poll before I put you in breakout groups, if you don't mind indulging me for a moment. Great, this is good. Because we hear things, we're using this feedback to try to plan our upcoming events, social gatherings, workshops, and trainings. And members have also asked us for guidance on this. So we thought we'd take the pulse of this group to understand where you are. Some of us are making decisions regardless because we have to get back to business. But we'd love to share some of this anecdotal feedback with those that are asking us for this kind of information. Okay, great. Thank you. And then I've got a couple more here. What are your top concerns right now? Select all that apply, and please add any others in the chat box. We're trying not to overwhelm our members with surveys, but it'd be great to know how we can help and what kinds of coaching or guidance or workshops we can put together for you in the coming year. Okay. Okay. I'm going to share the results. Looks like funding and financial challenges are of top concern, as is hiring and retaining staff and health and well-being of employees. Okay, just give me one. What workshop topics, sessions are you interested in? And feel free to type others in the box. You've heard about some of these that we're planning already. Board development, justice, equity, and belonging training, peer affinity groups, fundraising, HR challenges, employee and client safety, addressing racism and implicit bias, financial management, reopening safely or well. And then if you have other ideas, please drop them in the chat box. We would really appreciate your feedback. fundraising seems to be one of the top areas of need, which makes sense. And then of course the peer affinity groups, which I'm thrilled to hear about. We're looking forward to reconvening in person this summer and this fall. And we've got just one last question. So we have been, would you be interested in coaching consulting services regarding reopening your organization safely and legally if offered low cost or complimentary? In addition to reopening, we're also looking at general coaching or consulting services from nonprofit leaders around the city that have approached us, and we may need to seek funding for it to cover the expense. So we are just trying to get a sense of whether our membership would be interested in this kind of service or program. Okay, great. Well, thank you very much for indulging me in that little exercise there. For those that are interested in staying on, you're welcome to come off screen. I know we don't have a big group at this point. We're welcome to have one big conversation here, or we do have breakouts with some reflective questions for you to dialogue on for the last 10-15 minutes here. Feel free to come off mute and share your preference. I don't want to put everyone into breakouts if we don't want to go there. And our board members, feel free to pipe in as well.
I feel like there aren't that many of us left. Maybe we stay as a group.
Sounds good. Great. So one of the questions that I got, and maybe some of you can answer, is in terms of meeting up this summer for peer groups and whatnot, are you interested in meeting outdoors or indoors? And does it, how is that affecting your activities and what you're planning? When we say we want to meet in person, is there a comfort level indoors, outdoors? Does anyone want to share how they're handling this or how they're feeling?
Well, I mean, I can say that we had our very first in-person rehearsal this week. That was, everybody there was vaccinated. So, I mean, that's really something that's, obviously possible and was very comfortable. But it was comfortable for everybody.
So Arlene, did you ask for proof of vaccination in any shape or form?
We've never asked for proof. It's every time someone gets vaccinated, they let us know. And what happened was we had a couple of schools that actually allowed us to be in person for our residencies. And so it involved probably a really large group of our teaching artists, and they all got vaccinated because they were classified as educators. So it was early on. And then because our touring company was about to film this new piece that's going to come out on June 23rd, they knew they were all getting back together. And so a couple months ago, they all got vaccinated. So no, we didn't need to really ask anybody. They told us.
Okay. Anyone else want to share their thoughts on gatherings? Todd, hi, it's so great to see you. Thanks for being here.
Hi, Shamila, great to see you. Yeah, I just wanted to mention yesterday, the Staten Island Chamber of Commerce had their golf outing where they actually honored past chairman and chairwomen from the chamber, which I thought was great. And have to say, felt safe, felt great. People playing golf, very confident in shaking hands and hugging. And it was outside, it was inside. And same can be said for another nonprofit. Community Resources had their golf outing on Monday, also at Grand Oaks Country Club. Great attendance, and everyone seemed just excited to be out and getting to speak with people and seeing full faces. I mean, sure, this Zoom call, we get to see everyone's face, but it's something else to be in person. So I think everyone's just excited to be out and feeling very comfortable. No need for showing of vaccine card or anything like that. I think everyone's just pretty confident at this stage in the game, which is great. And I know there's, need to be cautious, optimistic, but, got to be cautiously optimistic. So, but yeah, and just real quick, when it comes to events, always want to think about, for those who may not make it in person, there's always a broadcasting option. There's always a way to still produce it for those who might be at home. And that continues to be, I think, a desire for some nonprofits that we've even seen and some requests we've gotten. So a very interesting landscape. Some things that happened during quarantine and not being able to have in-person events, still holding over for events and still be able to broadcast online, much like what you're doing right now, Shamila, broadcasting this meeting right now. So just wanted to add that, Shamila, but looking forward to getting back out there.
I'm so glad that you mentioned that, Todd, because we've actually had several members and partners encouraging us to make sure as we do go back that we continue to make an electronic or virtual option possible. And I think you last fiscal year did share with our fundraising peer group some of the interesting and exciting ways that you can do that. So we at SINFPA are looking forward to exploring that and presenting those options to our members, to our nonprofits, on how you can do both. I think particularly from a fundraising and donor engagement and community engagement perspective, we've seen how you can amplify by doing a hybrid model. So thanks, Todd, for reminding us about that.
My pleasure. Great to see everyone.
Other thoughts or ideas? Yeah, go ahead, Susan.
Yeah, I would like to amplify what Todd said about sometimes it's better to have the Zoom meetings, because I had 3 meetings this morning and I never would have been able to go to 2 of them if they were all in person. So there's something to be said for that. There's also something to be said for getting together and being in person, which is wonderful. We're also doing outside rehearsals now at the Biddle House down on the South Shore, way on the South Shore. And everybody's vaccinated. And it's been wonderful. We'll have outdoor performances. That's how we decided to open up as opposed to indoor performances. And we're looking forward to seeing a lot of people there. So in terms of some events, outdoor, yeah, would be great. And indoor, if you feel comfortable doing that.
I'm curious, is the indoor piece dependent on vaccinations and transmission rate of COVID? Is that the barrier or the concern for most people? Because one of the things we're hearing on the co-ed work side is, and you heard Dr. Ginny mention it too, our rates are not where we want them to be in terms of vaccination. And so we have heard from some nonprofits and businesses that it's just tough to make some decisions because there's so many unknowns still. And so, yeah, I was just curious about.
Jamil, if I may, I know the Grace Foundation has a gala coming up, I believe on the 25th, Friday. And they're actually, I think Kathy just mentioned in the chat, and they're turning people away. And again, just to reiterate what happened yesterday, what happened Monday, yeah, it was packed. I mean, there were 60, 70 golfers yesterday at the Chamber of Commerce golf outing at Grand Oaks. And then there's another 80 or 90 people who want to come for dinner too. So it was, a packed Grand Oaks hall. And again, I think just the excitement to get out. So again, cautiously optimistic. I know the strains are of concern to people. But again, I think what Dr. Ginny was mentioning, the vaccines are effective. I think we're just excited to get out. So, as the Grace Foundation is seeing, they can't even keep up. It's just too many people are wanting to get out.
Yeah, Todd, I'll jump in there. So we had our grand opening on the 22nd, and we had over 200 people show up. It was outside. Everyone was just excited, to your point, to see people. They did wear masks when they went into the building to see our new space, but outside, people were just happy to see each other. And I think for us, as an organization going forward for programming, it's going to be a hybrid model. Those who feel comfortable coming in, that's great. But, the silver lining to Zoom is it's allowed us to reach people that in the past maybe couldn't physically make it to the center. So we intend to keep them engaged in our programming going forward. So that's our plan.
Excellent, excellent. Well, thank you all for sharing, for staying on till the end. We are coming to the conclusion of our annual meeting of members and partners, and we have lots to look forward to. We continue to look to you to partner with us, reach out if you're hearing of things that we can help amplify, help publicize, help partner on, or bring more people to the table. With that, we bid you farewell for now, and we will hopefully see you in person this summer at some of our workshops. And as Arlene mentioned, our summer gathering in August or September. Continue re-emerging, continue reflecting. Let's all look forward with hope that you've all expressed today, and we are grateful for you. So I leave with a great sense of excitement and gratitude for all that is our community. Thank you.